your braces like this. You're just pushing food deeper and trapping plaque. Instead, angle your brush 45 degrees to sweep away plaque from above and below the wires. And here's the secret. Use a floss threader to clean that tricky space under the main wire. For more tips, hit subscribe. Every new subscriber means a donation to dental health charity. Why do teeth turn yellow? Everyday habits like coffee, smoking, tea, and dark drinks leave stains behind. Professional whitening uses safe bleaching agents to break down stains and brighten your natural smile. Forget viral hacks. They can harm enamel and won't match professional results. The secret to a white smile? Good habits, regular dental care, and safe whitening. Subscribe to Dr. Sila Biolabs. Your support helps spread dental education and contributes to initiatives supporting cancer patients.
Many babies and kids suck their thumb because it feels calming and comforting. But if thumb sucking continues for too long, it can affect how teeth grow and align. It may cause bite problems, changes in the mouth, and sometimes speech difficulties. Love, patience, and positive habits can help children slowly stop thumb sucking. Subscribe to Dr. Sila Biolabs. Your support helps spread health awareness and supports our mission to help cancer patients with treatment support.
Think this tooth needs a crown? Watch what modern dentistry can do. First, the decayed tissue is carefully removed while preserving healthy tooth structure. Next, a custom stamp records the tooth's original shape before restoration. A bonding agent creates a strong connection between the tooth and the restoration. Composite resin is placed, and the stamp instantly recreates the tooth's natural bite. A curing light hardens the restoration, restoring both strength and appearance. Subscribe to Dr. Sila Biolabs. Every subscription helps support charitable donations. It costs nothing, but together we can make a difference.
Ever wondered what happens during a braces adjustment? First, we remove the old elastic ties and the previous arch wire. A new custom-shaped wire is inserted to guide your teeth. Fresh elastics lock it in, maintaining the perfect pressure. For a perfect, aligned smile, subscribe to Dr. Sila Biolabs.
When an adult tooth is lost, the dentist places a titanium implant screw into the jawbone. This implant will act as an artificial tooth root. Over the next few months, the implant fuses with the surrounding bone, creating a strong and stable foundation. Once healing is complete, a connector called an abutment is attached to the implant. A custom-made artificial tooth is then attached, restoring both function and appearance. Subscribe to Dr. Sila Biolabs for more dental science and oral health insights.
A dental implant acts as an artificial tooth root, replacing a missing tooth. A titanium screw is placed into the jawbone and naturally fuses with the bone over 4 to 6 months. Once healed, an abutment and ceramic crown are attached to restore your smile. Subscribe to Dr. Sila Biolabs for more dental insights.
It's called dental calculus, or tartar. Unlike soft plaque, calculus forms when dental plaque stays on teeth for too long. Minerals from saliva, mainly calcium and phosphate, harden the plaque into a stone-like deposit. Calculus creates the perfect hiding place for harmful bacteria. This can lead to bad breath, bleeding gums, gum disease, and even bone loss around the teeth. Dentists remove calculus through a procedure called scaling. Ultrasonic and hand instruments safely clean deposits above and below the gum line. Regular dental scaling helps prevent gum disease and keeps your smile healthy. Subscribe to Dr. Sila Biolabs. Every subscription supports dental education and awareness.
Hello everyone, welcome to Dr. Sila Biolabs. Today, we will be discussing the physiology of dental skin and calculus formation. Yes, why do we need skin and how the calculus is formed? Substance formed on your teeth when you don't brush for some time. Now, understanding the science of oral health. From plaque to calculus formation. First, the thing is formed is called the pellicle. It's a soft layer. We will be discussing each and everything in detail. Then the plaque is formed, and then the calculus is formed, and then the mature calculus. Okay? This is how the calculus is formed. The pellicle is a salivary protein's coat. The tooth surface within the minutes. That is the pellicle. And mature plaque. What is the plaque? Bacteria adheres to the pellicle. The bacteria in your mouth adheres to your pellicle, multiply and form a biofilm that is called plaque. Calculus. Minerals in the saliva or gingival clavicular fluid precipitate into the plaque. That is the calculus formation. And then, how the mature calculus is formed. Calculus hardens, becomes porous, and promotes further plaque retention. That is how the mature calculus is formed. Today, we are diving deep into the topic that is critical to a tooth, both daily oral hygiene and clinical periodontology, the physiology of dental scaling and calculus formation. Whether you are a patient wondering why a hygienist scrapes off your teeth, or a medical student looking to master the biochemistry of biomineralization and periodontal disease, this comprehensive lecture is designed just for you. Let's break down the science of a smile. Understanding the why. Value the care. Keep smiling. Dr. Sila, Biolabs. This will be our lecture. And healthy gums doesn't just happen. They are engineered through science, care, and consistency. In today's lecture, Mastering the Physiology of Dental Scaling and Periodontal Diseases, diving deep into the biochemistry of biomineralization and calculus formation, and a comprehensive lecture designed for students and patients seeking the clear science. Here at Dr. Sila Biolabs, our mission is to empower medical education and simplify complex oral biology. In today's video, we are going to explore dental scaling, why it is necessary, how simply plaque transforms into calculus, the biochemical triggers of bad breath, what physiology happens during the healing phase after a deep clean. We will also address some common patient anxieties, such as temporary sensitivity and why teeth can sometimes feel slightly lighter, looser, right after scaling. So let's get started. So actually what dental scaling is. Scientifically, dental scaling is a non-surgical periodontal procedure. It involves meticulous mechanical removal of plaque, bacteria, biofilm, toxins, and hard calcified minerals deposit from both supragingival, which means above the gum line, and subgingival, below the gum line. Two surfaces, supragingival and subgingival, above the gum line and below the gum line. You can see supragingival above the gum line. The calculus is formed. And below gingival line, that is subgingival, below the gum line. Okay? Beneath the roots. Beneath, just below the gum line. Okay? Dental scaling is a precise, non-surgical therapy that removes the plaque and calculus from above and below the gum line to restore the oral health and promotes the natural healing. Now, what is the clinical objective? The ultimate clinical objective here is to eliminate the local irritants, restoring a biological, clean, smooth root and enamel surface so that your gums can naturally reattach and heal. You can see before scaling, the gums swollen, the calculus is here, and after scaling, you can see clean tooth surface, healthy gums, reduced inflammation, support, and reattachment of the gums. Before scaling, telling what it was? Plaque, tartar, calculus, bacterial toxins, and inflamed gums. You can see. Okay? So scaling is just a non-surgical procedure, mechanical removing of the plaque, bacterial biofilm, and hard calcified mineral deposited supragingival and subgingival. Okay? The clinical objective was restoring a biological clean, smooth root and enamel surface, enabling the natural gum reattachment and healing. Now, why do we need scaling? Why do we need scaling? Home care has its limits. Toothbrush and floss are excellent at disrupting soft and uncalcified biofilm. Mineral fusion occurs. If plaque is left undisturbed, for some time, for a short period, it begins to bind with calcium and phosphate minerals that present in your saliva. Bone defense is compromised. Once this chemical fusion occurs, the plaque hardens into the calculus. Brushing will no longer remove it. If left untreated, the calculus is physical shield for active bacteria which secrete toxins that slowly destroy the surrounding periodontal ligament and alveolar bone. These toxins, what does they do? They secrete toxin. These bacteria secrete toxin which slowly destroy the periodontal ligaments and alveolar bone. I will be showing you some differences between plaque vs calculus, the transition of the plaque to calculus formation. Now, the calcified mineral deposits. Okay, this is calculus. Now, composition. 80% of the, we are discussing the discussion of plaque first, okay, composition of the plaque. 80% of the organic salivary glycoproteins, mucins and lipids, and 20% of inorganic contains living bacteria and byproducts. While the calculus is 80 to 90% of the calcium phosphate crystals, hydroxyapatite, octocalcium phosphate, and 10 to 20% of minimal or no living bacteria. Plaque, yeah, it can be easily removed at home from toothbrushes and dental flosses. But calculus, it cannot be removed at home, requires professional. Removing uses ultrasonic scalers or hand curettes. Threat, plaque, it can lead to gingivitis, cause mild reversible inflammation, redness, swelling, and bleeding. Okay? It will trigger gingivitis, reversible inflammation, redness, swelling, and bleeding. But calculus, it causes periodontitis, leads to chronic inflammation, and pocket formation and permanent bone loss. You can see what calculus is doing. What calculus is doing? Chronic inflammation. Chronic inflammation. Periodontal pocket and destruction of the bone. That's what this is doing. So plaque is the cause, calculus is the consequence. Remove the cause early to prevent the irreversible damage. Plaque, gingivitis, calculus, and then periodontitis. That is irreversible. So professional care makes the difference. Okay, so what plaque to calculus? As we discussed, plaque, soft, sticky. Calculus, rocky hard. Plaque has salivary proteins and living bacteria, while the calculus, calcium phosphate crystals. Okay, plaque can be removed by brushing and flossing, and calculus, it can be removed by scalers and curettes. Plaque, mild reversible inflammation, and calculus, permanent irreversible bone loss periodontitis. Now let me describe the main culprit dental calculus in detail. Think of a calculus as a fossilized plaque. When a soft biofilm is left undisturbed along the gum line, it acts as a scaffolding matrix. Over time, mineral salt precipitate into this matrix. Although the calcified core of the calculus consists of largely dense fossilized bacterial cells, its outer is extremely rough and porous. Calculus is bacterial reservoir. This is rough porous that makes calculus the perfect harbor of a new life, highly pathogenic. Colonies to attach, multiply, and constantly secrete destructive toxin directly into the gum tissues. Bacteria attach to the rough surface, bacteria multiply and form colonies, bacteria release toxins. Now, toxins penetrates gum tissues and causes destruction. See the pathogenic reservoir, dental calculus. Now, fossilized biofilm, calcified forming a dense matrix, rough porous surface, you can see, not solid, extremely irregular topography. Bacteria harbor the perfect safe house for pathogenic colonies to attach and multiply. Bacteria constantly secrete toxins into the gum tissue. Outer porous matrix, you can see. These are the bacteria secreting continuous toxins to your gum tissues. Pathogenesis step by step. First, the pellicle is formed within minutes of brushing. An acellular protective film of salivary glycoproteins. The acquired pellicle coats the enamel within minutes. Then, biofilm, that is plaque, bacterial colonization within 24 hours. Primary bacterial colonizes adheres to the pellicle and multiply to create a dense biofilm. Then, mineralization of the calcium phosphate begins. Calcium and phosphate ions from the saliva start to precipitate into the matrix. Then, fossilization of the plaque, maturation of the calculus by the day 12. Fossilization, maturation of the calculus by the day 12. The deposit matures into the fossilized, rock-hard crystalline structure that is permanently locked onto the tooth surface. Calculus provides a retentive surface for more plaque formation, protects bacteria from the host defenses, and contributes to gingival inflammation and periodontal disease. So remove early, prevent damage, and preserve your health. Phase 1, acquired pellicle, salivary glycoproteins. Phase 2, plaque biofilm within 24 hours. Phase 3, mineralization begins. And phase 4, fossilized maturity by the day 12. Okay, leading to the calculus. Acquired pellicle, salivary glycoproteins, primary bacterial colonizes adheres. In phase 2, phase 3, calcium and phosphate mineralization centers, and mature fossilized structure, rock hard, locked to the tooth. Okay, the role of saliva in calcification. A fascinating physiological paradox lies in the role of our saliva. Saliva is biologically supersaturated with calcium and phosphate ions. Under normal conditions, this is wonderful protective mechanism. It continuously remineralizes and repairs our tooth, protecting us from decay. However, if the plaque biofilm is present, this plaque biofilm is present there. Saliva act as double sword, salivary gland ducts, like under your tongue, behind your lower teeth. Local pH changes triggers the spontaneous precipitation of the rich minerals directly into the soft plaque, cementing it into a hard tartar. What is the composition of dental calculus? 90% of mineral origin. Dental calculus is approximately 90% minerals by weight. That is calcium, 65 to 75, phosphate, 15 to 20%, carbonated magnesium, 5 to 10%. The majority comes from your saliva, where calcification begins. Now, I've told you the salivary gland ducts of the tongue, open under the tongue, behind the lower front teeth, delivering saliva rich in minerals. pH changes, local pH increases, becomes more alkaline around the plaque, promoting mineral precipitation. Mineral precipitation, calcium and phosphate ion precipitates into the plaque biofilm, hardening it into a dental calculus. That is a tartar. Understanding to the diagram, I'm showing you the diagram also. Saliva is basically biologically supersaturated with calcium and phosphate ions, essentially for enamel remineralization, good and good of course, and spontaneous plaque formation, plaque calcification, that is bad. Saliva, openings of subgingival gland duct, soft plaque is formed, and then mineral precipitation hardened to the plaque tartar. Now, why the calculus is so hard? The biological concrete analogy. Civil engineering concrete, aggregate, cement, binding result, right? This is the concrete civil engineering. Actually, calculus is just not a hardened plaque. It is mineralized, fossilized mass where organic and inorganic components are interlocked, just like a concrete. I told you in the calculus what it is: biological aggregate, bacterial cell, extracellular, polymeric substances, and debris provide the organic framework. Mineral cement, precipitated calcium phosphate, salt, and hydroxide type of the calcium phosphate. Binding result, a dense crystalline mass that is highly mineralized, irreversible, and extremely resistant to removal. Remind the plaque why the calculus it cannot be removed from the brush. The mineral crystals penetrate and lock into the microscopic things. The irregularities of enamel and cement and creating a mechanical interlock. This cannot be removed or rinsed away by brushing through mouthwashes or through floss. The floss removes the plaque between the teeth, but calculus is fused to the surface. Through the mouthwashes, chemical, it cannot be removed. It says toothbrushes are too soft. So once the calculus is formed, it requires professional mechanical removal with ultrasonic scalers and instruments designed to break the mineral aggregate bond. Professional removal is essential because biology built it strong and only science can remove it. To look at its biology chemical perspective, the inorganic mineral content of calculus shift through different crystalline phases at its ages. Yet it is also different crystallines. Like a mature calculus, hydroxyapatite, young calculus, brushite, and subgingival calculus is called common in subgingival pockets, magnesium containing calcium phosphate. Okay? First, the mature is hydroxyapatite, crystalline phase, calcium phosphate hydroxide. Second, the soft or young calculus is called the brushite, dicalcium phosphate, dihydride, and the subgingival is called whitlockite. Here is a chemical, you can see. Ionic, I can show you calcium phosphate hydroxide. This is the brushite, and this is the Widlokite subgingival. Why it matters now? These different crystalline phases reflect the age, environment, and location of the calculus. Understanding them help the clinician evaluate the age and density of the patient's deposit and plan the appropriate treatment. Young brushite maturing transition to the mature hydroxyapatite. If it's a subgingival, it's Widlokite. Young calculus, brushite. Then hydroxyapatite, mature calculus. Then the subgingival into the pockets, periodontal pockets, is Widlokite. Mineral transformation over the time, plaque, young calculus, mature, and deep calculus. So clinicians evaluate the calculus age density using these phases to guide the periodontal treatment. The pathological symptoms: bad breath, tooth destruction, and permanent jawbone loss. Bad breath, tooth tissue destruction, and then permanent jawbone loss. Now that we understand calculus is chemically and biologically, let's explore the destructive pathology. How exactly does this calcified rock trigger severe bad breath? Tissue. How does this do? Okay? First, coming to why calculus caused the bad breath. The mechanism halitosis, bad breath. Anaerobic bacteria, lack of airflow, deoxygenated shelters, breeds destructive anaerobes. Lack of airflow. It's going in the periodontal pockets, you can see. Then, debris trapping, biological sponge, it acts like a sponge, collecting all the rough, porous surface, traps food and dead cells. Okay, it collects the food, traps food and dead cells. Then the toxin secretion, that is the foul smelling that comes from your mouth. Toxic waste, anaerobic bacteria, trap debris. Bacteria ferment the trap debris, release toxins. That leads to bad breath. See, low oxygen environment, anaerobic pockets, calculus creates deep physical shelters under the gum line. Because oxygen cannot easily reach there, it creates perfect breathing ground for highly destructive oxygen-hating anaerobic bacteria. Then you can see debris trapping, food particles, dead cells. The rough porous surface, it acts like a sponge, trapping the food debris and dead cells, which decompose. Then coming to the toxin secretions. These anaerobic bacteria feed on this trapped debris. They continuously ferment nutrients and release foul-smelling toxic waste directly into their mouth. So, the combination of anaerobic bacteria decomposing debris and toxic secretion creates a persistent source of foul odors. That is chronic bad breath. The biochemistry of halitosis. Let's look at the organic chemistry behind that smell or behind this odor. The offensive smell of halitosis caused by volatile sulfur compounds. These gases are produced when anaerobic bacteria break down the amino acids. Hydrogen sulfide, methylcaptan. No, hydrogen sulfide smells like a rotten egg. When it comes to methylcaptan, pungent odor of just like a rotten cabbage. Oh, yuck. And then the dimethyl sulfate acts as a sweet, heavy, musty undertone. That leads to bad breath. This is mechanically the calculus that has to scale away, eliminating the anaerobic harbors where these bacteria live. So the only way to permanently cure this type of bad breath is to mechanically scale away the calculus, eliminating the anaerobic bacteria. Their harbors where there are bacterial life. Volatile sulfur compounds, the primary cause of halitosis, thrive into the deep pockets, these bacteria. Okay, two locations of the two distinct hazards. That is, I told you previously also, the supragingival calculus and the subgingival calculus. Okay, the supragingival calculus above the gum line. You can see above the tooth. You can see it, highly visible. Color, texture, yellow, white, chalky, mineralization source, saliva, and hazard, aesthetic, and hygiene challenge. When it comes to subgingival, okay, deep within the periodontal pockets, brown or green color, mineralization source, serum from the bleeding gums. Primary driver of chronic bone destruction. Again, giving you a rough summary. This is above the gum line, yellow, white, from the saliva, visible, represent aesthetic and hygienic challenge. And subgingival, you can see, brown, green, or black, mineralized serum, blood-driving proteins. Location forms deep within the periodontal pockets, primary driver of chronic bone destruction. While both are harmful, subgingival calculus is the most destructive threat to your oral and systemic health. Coming to the danger of the gum recession, as the subgingival calculus accumulates, it creates physical and biological hazard because the calculus is covered in active toxic bacteria. Your body's immune system recognizes a massive chronic infection. In an effort to retreat and protect itself from these bacterial toxins, your delicate gum tissue and the underlying jawbone begins to pull away. This localized retreat is what we clinically call the gum recession, leaving the sensitive root surface of your tooth exposed. Gum recession is not just a cosmetic issue. It is a clear sign of chronic infection and beginning of the irreversible damage. Toxic bacteria. Calculus is a reservoir for harmful anaerobic bacteria. Immune response, the body recognizes as chronic infection. Tissue retreat, gum tissue pulls away from the tooth, escape from the bacterial assault. Root exposure, recession exposes the sensitive root surfaces leading to pain and bone loss over time. The underlying jawbone is already resolved. Massive chronic infection, bacterial toxins, immune response, localized retreat, and exposed root surfaces. Fine. As the subgingival calculus accumulates, it creates severe physical and biological hazard. Because the calculus is covered in active toxic bacteria, your body immune system recognizes a massive chronic infection. As I told you, in an effort to retreat and protect itself from the bacterial toxins, your delicate gum line and tissue, what does they do? They pull themselves away from the jawbone. This localized retreat is what they clinically call the gum recession, leaving the root surfaces of your teeth exposed. This bridge erosion. This is a massive continuous calculus block, not supporting the tooth structure, of course. A solid temporary wall of mineralized growing teeth in an unhealthy position. Silent bone destruction deep beneath the bridge is a chronic infection actively dissolving your jawbone. As a jawbone density melts away, the calculus bridge acts as a visual shield, hiding the extent of damage. Splinting teeth, this rigid artificial cement provides a false sense of stability. The patient perceives the strength while in reality the underlying support is compromised and the teeth are held by the disease itself. Now what is the scaling? The scaling procedure. Demystifying professional cleaning, temporary sensitivity, exposed dentine can react to temperature and pressure during healing. Temporary mobility, teeth adjust to the removal of the rigid, stabilizing disease, spring as a support structure. Okay, now let us demystify the actual dental scaling procedure. What's happening during the professional clean and why do patients experience temporary sensitivity and mobility afterwards? First, we do the exam and assessment. We examine your gums, measure the pockets, and take x-rays. Then the ultrasonic scalers we use, or hand instruments, carefully to remove the plaque above and below the gum line. Smoothing the surface, or very smooth the root surfaces, helps the gum to reattach to make it harder for bacteria and stick in the future. Polishing and rinsing. Rinse thoroughly and polish your teeth to remove surface stains and leave your mouth feeling clean. Post-op, we provide personalized care instructions to support healing and reduce sensitivity. Healing begins, gums start to heal, inflammation decreases, and your foundation becomes stronger over time. When calculus is removed, teeth may feel sensitive to hot and cold pressure. They also may feel slightly loose. This is temporary and normal. It's a sign that infection and artificial spring are gone, and your mouth is beginning to heal. Recovery is a part of the process. Sensitivity typically improves within 1 to 4 weeks. Mobility improves over several to months as the gum and bone heal and re-stabilize your teeth naturally. So clean today, heal tomorrow. Stronger smile for your life. How scaling is performed: ultrasonic and hand scaling methods. Ultrasonic scalers, high frequency, micro vibration, gently checkers the mineralized calculus without scratching enamel. Water level spray used, the scaler water is coming continuously. Pulls instrument, tip flushes the pathogens, blood and tartar from the pockets. Specialized hand instrument. Flying hand finishing smoothens they smooth the root surfaces, leaving them clean and resistant to the plaque. Use ultrasonic scalers, water level spray, and hand scaling. The goal of scaling is not just to remove what's visible, but it's to clean where the disease hides. Removes infection sores, preserve bone, and gum health, protects your natural teeth. Okay, patient comes to us. They say, the common complaint is, my teeth were not sensitive before you cleaned them, but now they are. Now, let's explain the physiology behind this. It was covered with a hard calculus. Before scaling, it was covered with a hard calculus. It's blanket that isolates the root. Think of a calculus as a dirty, insulated blanket. When we remove this cold, hot and cold blocking minerals shield, the underlying roots are suddenly exposed to the oral environment. After scaling, root surfaces are now exposed. Exposed dentin tubules and nerves. But don't worry, it will heal with time. This exposes thousands of microscopic channels called dentinal tubules, which leads directly to the tooth nerve. Sudden exposure, temporary sensitivity to hot, cold, or air. As your mouth continues to oral health, heat, gum line over the tooth neck, and the healing occurs after scaling. Gum shrinks to a healthy level, exposing to the tooth neck. Most patients improve within 1 to 4 weeks using desensitizing toothpaste and proper home care. It can speed up the process. See how sensitivity triggers. Okay, sorry for the interruption. Exposure of the dentinal tubules, dirty insulated blanket, and sensitivity triggers. When we remove this calculus, what happens? This whole area is exposed, leading to sensitivity. resolving gums, swelling gums, and then the healthy gums. As gum heal, they shrink to their healthy size, exposing to the tooth neck. So post-sensitivity is normal. It's temporary sign of healing. Now some patient came and say that our teeth feel loose after scaling. See this. This is the calculus bridge. A sudden alarming sensation of slight tooth movement after treatment, unmasking the damage. We remove this bridge. That is joint. This is joint from here, this joint from here. And it's causing the gum recession. When we remove it, the teeth slightly feel mobile. The clear part for gums and remaining ligament to tighten them and heal around the roots. It takes some time. When we remove the rigid calculus, it reveals the underlying bone loss from the prior infection. And the clear part for gums and remaining ligament. It takes time to heal. So removing calculus reveals the damage. Healing tightens the gums. See, before scaling, calculus bridge hides bone loss and splints the teeth together. After scaling, calculus is removed, severe bone loss is revealed. Teeth may feel looser. It unmarked bone loss caused by infection. The calculus which was artificially holding the teeth together is gone. It takes time, but it's happening. So after scaling, your mouth needs time to adjust. It can feel strange when thick teeth are suddenly gone and your teeth are no longer tightly splinted together. Scaling removes the calculus and biofilm, revealing the true level of the bone loss that the infection caused over time. Feel slightly mobile teeth temporarily. Gingival reattachment. Now that physical barrier of tartar is removed, the biological path is clearly for your gums and remaining ligaments to tighten and heal around the tooth. Mobility improves as a healing progress. With good home care and regular maintenance, your gum line stabilizes and comfort returns. Clean today, heal tomorrow. Stronger foundation for your life. So healing is happening every day. Clean today, healthy tomorrow. With good home care and regular visits, your gum will continue to heal and stay healthy. Thank you for taking the first step towards a healthier smile. Bacterial toxins are gone. Gums are healthy and strengthened, strong, healthy, and protective. While this white bone cannot spontaneously grow back, your healthy, tightened, infection-free gums will provide a firm, strong, and protective seal around your teeth. Healthier gums don't bleed, less sensitivity, and stronger protection for time. A cleaner, fresher, more confident smile. The gums will heal, don't worry. Your body immediate healing response. Bacterial toxins are gone, resolving inflammation, protective seal. Your tightened infection-free gums provide a firm, strong, and protective seal around your teeth. The long epithelial junction forming a tight hug again. Swelling and bleeding, healthy tissue, form attachment, immunized protective zone. Okay, what if we don't remove this calculus? We don't remove this calculus. The alternative chronic unchecked destruction. What if we don't do scaling? What will happen? To emphasize the importance of this treatment, let's examine the alternative. What happens if the patient refuses scaling and allows this calculus to build up indefinitely? Irreversible damage. Now, calculus keeps binding, building hard deposit, thickening and spreading below the gum lines. infection continues, bone loss progresses, and then the teeth loosen and fail. So scaling stops the cycle and healing starts. The downward spiral of neglect. Gingivitis, it starts from gingivitis, where bacteria causes reversible gum swelling and bleeding. Reversible, early treatable, and damage can be reversed. Periodontitis. If left unscaled, it will progress to periodontitis. The infection moves below the gum line, forming the deep oxygen depleted pockets. Below the gum line, the body cannot gradually clean these pockets. Bone loss. This triggers chronic local inflammation leading to bone loss as the jawbone dissolves to escape the bacteria. Permanent damage, the supporting bone loss is destroyed and cannot be grown back. Tooth loss. Ultimately, this leads to the third tooth loss, where the tooth loses its foundation. It must be bone loss and then tooth loss. From inflammation to tooth loss, break the spiral. You have to break the spiral of neglection. Severe infection and a silent infection, a serious threat. As subgingival calculus travels deeper, it seals off the periodontal, turning it into a highly pressurized anaerobic bioreactor. Seal pocket, anaerobic bioreservoir. Deep pockets, pus formation, abscess. Bacteria hide deep below the gum line before you can reach them through brushing. Pus formation with white blood cells resulting in the pus pungent discharge. Abscess. If drainage is blocked, a thrombing pain periodontal abscess forms. Okay, the risk of delay, severe pain, thrombing, constant deep and often unbearable. Facial swelling, infection can spread, causing visible swelling, fever and systemic distress and bone destruction of course. The silent infection continues to dissolve the supporting bone. So delaying the scaling out of fear of the losing teeth only allows the silent infection to dissolve your bone. So professional scaling, stop the infection, save your teeth and protect your health. So 80% of the bone loss potential, irreversible process, severe disease and root exposure. Okay, alveolar bone loss and the tissue destruction. Healthy teeth, healthy gums and full alveolar bone support. Gingivitis, inflammation continue to the gums. Early periodontitis, below the gum line, bone loss begins. Moderate bone loss, continued infection destroy the bone, deepening the pockets. Severe bone loss, extensive bone loss, destruction, teeth become unstable and then it falls off. What does 80% bone look like? Teeth lose their foundation, chewing becomes difficult, teeth become loose and shift, greater risk of tooth loss and infection. You can see it through this. This is the healthy foundation, standing straight. Severe bone loss, it's trembling in the mud, just like trembling in your mouth. For medical and dental students, bone loss is largely irreversible process, while gum tissue can heal and reattach. Once the alveolar jawbone is destroyed by the chronic periodontitis, it is good for good. Severe untreated periodontal disease can destroy up to 80% of the bone loss and the tissue structure. Regular scaling is the only way to stop this destruction in its tracks. So don't wait for the bone loss, prevent it, protect your teeth, protect your health. Early intervention today is a stronger smile tomorrow. So this periodontal disease is not just an oral issue, it affects your overall health of the body. Cardiovascular disease, bacteria and inflammatory cytokines from the gum infection increases systemic inflammation. Cytokines to arterial plaque formation increases the risk of heart diseases and heart attacks, linked to strokes and vascular events. Diabetes control, chronic gum infection worsens the insulin resistance, making blood sugar incredibly difficult to control. Poor glycemic control, increased risk of system diseases. Respiratory health, inhaling the oral pathogens can lead to bacterial pneumonia, especially in elderly or medical compromise. So your oral health is connected to your overall health. Overall health, healthy gums, healthy body, healthier life. Regular scaling and periodontal care protects more than just your smile. It protects your smile. Don't ignore your gums. Treat periodontal disease. Protect your teeth. Preventing the calculus formation, brush twice a day. Floss. Use alcohol-free antibacterial mouthwashes. Brush, floss, rinse, professional care. So daily care plus professional care. A lifetime of healthy teeth and gums. So our educational mission, outreach, expand access to dental health globally, mentor of the future of the dental researchers, engage in the community, get involved with Dr. Sila Biolabs, join our network. Our mission is empowering the minds, improving lives. Dr. Sila Biolabs is dedicated to advancing global oral health through science, education, and community engagement. So join our mission. Let's share, inspire. Together we can build a healthier world, one smile at a time. Stay connected. Knowledge today, healthier tomorrow. So our dual video mission was for patients worldwide, demystifying the oral care of oral biology, breaking down the complex dental pathogens into clear, practical concepts that help you control your health. For medical and dental students, provide high shield, scientifically accurate and visually engaging study aids to help ace your goals, excel in your clinical rotations, and master your periodontal sciences. Our mission, demystifying the oral care, understand your oral health, practical tips, prevent, and for medical students, high yield content, scientifically accurate, visually engaging. Thank you for watching. Stay tuned and stay informed. Stay healthy. Together, we build a healthier world. Dr. Sila Biolabs, where science meets education and compassion. Thank you for watching. Thank you for joining us today in the clinical lecture. If you found this helpful, explanatory, please hit the subscribe button to join the Dr. Sila Biolabs community. We are here to help your master medical sciences. Subscribe, join the community. If you are a patient with questions about your teeth, or a medical student looking for an academic guidance, please leave your questions in the comments below. I will read it and answer them personally. Dr. Sila, dedicated to advancing health and education. Stay connected. Until the next time, stay curious, keep learning, and take care of your smile. Giving you the image resources. Now subscribe and join the community, Dr. Sila Biolabs. Thank you all. I will join you soon in the next lecture. What lecture you want it to be, you can comment me that too. Okay? Thank you, Dr. Sila Biolabs. Subscribe now.
Did you know a tiny titanium implant can replace a missing tooth and feel almost like your own? This titanium implant is carefully placed into the jawbone, creating a strong new tooth root. Your body accepts the titanium and your bone naturally grows around it. This process is called osseointegration, giving you a strong and natural-looking new tooth. I'm I'm Dr. Sila. Subscribe to Dr. Sila Biolabs. Every subscription helps support donations for cancer patients. Together, we can change lives. And signs of gum disease chair, paying particular attention to
The depth of gum pockets is measured. In healthy gums, these spaces are shallow. Deeper pockets may indicate periodontal disease.
3, 4, 7. Radiographs reveal bone loss that may not be visible during routine examination.
By combining clinical examination and radiographic findings, an accurate diagnosis can be made.
Once the examination is complete and treatment is planned, the next step is selecting the appropriate instruments for calculus removal.
One of the most commonly used tools is the ultrasonic scaler, which uses high-frequency vibrations to break apart hardened calculus. In the next section, we'll see in detail how ultrasonic scalers systematically break apart and remove hardened calculus from tooth surfaces. Although ultrasonic scalers are highly effective, hand instruments remain an essential part of periodontal treatment. These instruments are specially designed to remove deposits with precision. The most commonly used instruments include curettes and hand scalers.
Each instrument has a specific shape intended for different areas of the mouth. Hand instruments are particularly useful for cleaning below the gum line.
The curved design allows the instrument to adapt to root anatomy. This helps remove deposits that may remain after ultrasonic scaling. Even tiny remnants of calculus can be detected and eliminated. The goal is to leave the root surface as clean as possible. Hand instruments provide excellent control in difficult-to-access areas. They are especially valuable around complex root structures. Together, ultrasonic and hand instrumentation complement one another. Combining both techniques often provides the most thorough result. After deposits are removed, the clinician carefully evaluates the treated areas. The cleaner the root surface, the better the conditions for healing. Some of the most challenging deposits are found deep below the gums. These hidden deposits often require meticulous subgingival scaling. In the next section, we'll explore how dentists remove calculus hidden deep beneath the gum line. One of the most effective tools used during scaling is the ultrasonic scaler. At first glance, it may look like a simple metal instrument, but its tip vibrates thousands of times every second. These high-frequency vibrations are powerful enough to disrupt hardened calculus. Rather than scraping aggressively, the instrument uses vibration to fracture the deposit. The hardened tartar gradually breaks apart and detaches from the tooth. A stream of water is delivered at the same time. This water helps cool the instrument and flush away loosened debris. Balance. The combination of vibration and water can also help reduce bacterial buildup. Large deposits can often be removed naturally. The result is a cleaner tooth surface and improved access for further treatment. Most patients experience vibration.
Stop brittle. A suction device is commonly used to keep the treatment area clear and comfortable. However, not every area can be improved.
For fine details and difficult-to-reach areas, hand instruments are often used. These specialized instruments. In the next section, we'll explore how hand scaling instruments help achieve a thorough cleaning.
Some of the most harmful calculus deposits are completely hidden beneath the gum line. These deposits often remain undetected.
Hidden calculus provides a protected environment for harmful bacteria. They continuously release toxins that maintain inflammation and drive periodontal destruction deeper. Before treatment, the dentist evaluates the depth and extent of the periodontal pocket. This measurement guides the entire cleaning approach. Specialized ultrasonic tips are designed to reach deep beneath the gums. The vibrating tip carefully disrupts and loosens the hardened deposits. Hand curettes provide precise access to areas that require detailed cleaning. Once the deposits are removed, the source of chronic irritation is greatly reduced. The surrounding tissues can now begin to resume. The gums gradually tighten around the clean tooth. The ultimate goal is to create an environment that is easier for both the patient. But what does scaling actually feel like from a patient's perspective? Many patients wonder what scaling actually feels like during treatment.
For most people, scaling is a safe and well-tolerated procedure.
The most noticeable sensation is often the vibration produced by the ultrasonic scaler. Patients may feel a gentle buzzing sensation against the teeth. Many patients also notice a high-pitched sound created by the instrument. At the same time, cooling water is delivered throughout the procedure. This water helps keep the tooth and instrument cool while washing away debris. Cold water or contact with sensitive root surfaces can occasionally produce a brief, sharp sensation. For deeper cleaning procedures, local anesthesia may be recommended.
Many patients immediately notice that their teeth feel smoother and cleaner after treatment.
A common comment after scaling is that the teeth feel remarkably different. In the days and weeks that follow, the gums often become healthier and less inflamed. In the next section, we'll explore exactly what happens during the healing phase after scaling.
Once scaling is complete, the healing process begins almost immediately. For the first time in months or even years, the gums are no longer surrounded by bacterial deposits and calculus.
The bacterial burden is significantly reduced. As the source of irritation is removed, inflammation begins to decrease. This healing can make the gums appear slightly smaller than before treatment. In reality, the calculus was filling those spaces and masking the true anatomy. Gums become healthier, bleeding decreases, and the risk of disease progression is reduced.
Most importantly, scaling helps preserve the supporting structures that keep teeth functional for years to come.
In the next section, we'll learn how to prevent plaque and calculus from returning. After investing time and effort into scaling, the next question is simple. How do we stop calculus from coming back? The answer starts with understanding that plaque begins forming again within hours. Even after a professional cleaning, the most important defense is effective daily toothbrushing. Brushing helps disrupt plaque before it has an opportunity to mature. When plaque is removed regularly, it cannot easily mineralize into calculus. Using a fluoride toothpaste supports overall oral health and helps protect tooth surfaces. However, brushing alone does not clean every area of the mouth. Daily flossing helps remove plaque from areas between teeth. For some patients, interdental brushes may provide even better access. A balanced diet also contributes to better oral health. Frequent exposure to sugary foods can encourage bacterial growth. Regular dental examinations remain an essential part of prevention. Despite being one of the most common dental procedures, scaling is often surrounded by myths and misconceptions. Let's separate fact from fiction. Professional scaling targets plaque and calculus, not your enamel. The instruments are designed to remove disease-causing deposits while preserving the tooth beneath. Those gaps were already there, filled by hardened calculus. Scaling doesn't create the spaces. It reveals what disease was hiding. The looseness was caused by periodontal disease, destroying the supporting bone. Calculus was simply masking the damage. Scaling doesn't weaken your teeth. It removes the bacterial deposits that threaten them. Clean teeth are stronger teeth. Scaling is far more than cosmetic. Scientific evidence confirms it plays a vital role in preventing gingivitis, managing periodontitis. When it comes to oral health, evidence should always guide our decisions. Healthy gums, fresher breath, stable teeth, from plaque to calculus, from disease to treatment. Professional scaling is one of the most important steps you can take for your oral health. Despite being one of the most common dental procedures, scaling is often surrounded by myths and misconceptions. Let's separate fact from fiction. Professional scaling targets plaque and calculus, not your enamel. The instruments are designed to remove disease-causing deposits while preserving the tooth beneath. Those gaps were already there, filled by hardened calculus. Scaling doesn't create the spaces. It reveals what disease was hiding. The looseness was caused by periodontal disease, destroying the supporting bone. Calculus was simply masking the damage. Scaling doesn't weaken your teeth. It removes the bacterial deposits that threaten them. Clean teeth are stronger teeth. Scaling is far more than cosmetic. Scientific evidence confirms it plays a vital role in preventing gingivitis, managing periodontitis. When it comes to oral health, evidence should always guide our decisions. Healthy gums, fresher breath, stable teeth, from plaque to calculus, from disease to treatment. Professional scaling is one of the most important steps you can take for your oral health. Over the course of this documentary, we followed the complete journey of dental plaque and calculus. When plaque is not removed regularly, it becomes thicker and more complex, a structured community of bacteria working together. Minerals from saliva slowly harden the plaque through a process called mineralization. The result is calculus caphrates, also known as tartar. As bacteria multiply, the gums become inflamed, a condition known as gingivitis. Left untreated, it can progress into periodontitis. Fortunately, this addictive process can often be interrupted. Scaling removes plaque and calculus, while careful.
As inflammation decreases, the tissues begin to recover. Bleeding is reduced. Gum health improves.
Healthy gums are the foundation of a healthy smile. Prevention remains far easier than treating advanced periodontal disease.
We've come to the end of this journey inside dental science. From plaque formation to calculus buildup.
To professional scaling, and finally, healing.
What we learned is simple. Oral health is built on awareness and prevention. At Dr. Sila Biolabs, our mission is to bring science-based dental knowledge to everyone. Every subscription to this channel is more than just support. It directly contributes to awareness and welfare initiatives that help people in need. So please subscribe to Dr. Sila Biolabs and stay connected with us. Your support helps us continue creating meaningful, educational, and welfare-focused content. Stay with Dr. Sila Biolabs and keep smiling with knowledge.
teeth are turning yellow because of age? These everyday foods are secretly staining your teeth. Over time, millions of stain molecules build up inside your enamel. That's why brushing alone often isn't enough. Professional whitening breaks down stain molecules and restores a brighter smile. The best treatment is prevention, but whitening can reverse years of staining. Subscribe to Dr. Sila Biolabs. Every subscription donates a penny toward welfare and education. It costs nothing, but your one click can help somebody. Old dental work and hidden decay are carefully removed. This creates a clean, healthy foundation for the new composite veneer. Next, the tooth is isolated, etched, and bonded. These steps create a microscopic surface that allows the veneer to securely attach to the tooth.
Layer by layer, composite resin is artistically sculpted to recreate the natural shape, texture, and appearance of a healthy front tooth. After polishing, the composite veneer blends seamlessly with the smile. A fast, conservative, and beautiful solution for restoring damaged. Subscribe to Dr. Sila Biolabs. Your subscription helps support healthcare. But together, even one subscription can someone's life, in someone's life.
This tooth is badly damaged by decay.
First, the decay is carefully removed. The remaining tooth is prepared for a perfect crown fit.
The tooth is now perfectly prepared to receive its ceramic crown.
The custom ceramic crown is precisely fitted onto the prepared tooth.
Subscribe to Dr. Sila Biolabs. Red Heart every subscription helps support free patient treatment.
When a tooth is lost, the empty space begins changing your entire smile. Nearby teeth start shifting, affecting function, appearance, and bite stability. The zirconia bridge offers a durable and natural-looking solution. The supporting teeth are precisely prepared for the bridge. Advanced digital scanning captures every detail with remarkable accuracy. State-of-the-art CAD/CAM technology creates a strong zirconia restoration. The custom zirconia bridge is securely placed and blends seamlessly. Strong, natural, beautiful. Restore your smile with modern zirconia dentistry. Subscribe to Dr. Sila Biolabs. Every subscription helps support welfare initiatives and patient education. It costs nothing. Just one click can make a difference.
We start by isolating the tooth. Then, using the syringe, carefully apply a thin layer of the blue etching gel to the enamel surface.
The adhesive paste is smoothly applied to the bracket's fine mesh bonding surface. The bracket is then carefully aligned with the guideline. Subscribe to Dr. Sila Biolabs.
The dentist then identifies the entrances to the root canals. Magnification and illumination may be used to locate these tiny openings accurately. To ensure a precise pathway, the endodontic explorer gently glides across the chamber floor. The glowing blue overlay a properly designed access cavity is essential because it allows instruments to reach the full length of the canals safely and efficiently. Access opening, the gateway to root canal treatment. With the canals located and accessible, the cleaning and disinfection phase of root canal treatment can begin.
Using a combination of stainless steel hand files and nickel titanium rotary instruments, we meticulously clean and shape the complex anatomy. Cleaning the root canal system is critical. A stainless steel hand file is used to carefully explore the mesiobuccal canal. After locating the root canals, the next step is cleaning and shaping the canal system. Small instruments called endodontic files are introduced into the canals to remove infected pulp tissue. bacteria, and debris. The dentist first determines the exact working length of each canal to ensure treatment reaches the root tip without extending beyond it. Modern root canal therapy often uses flexible nickel titanium rotary instruments that can safely navigate the natural curves of the canals. As these instruments rotate, they enlarge and shape the canals, creating a smooth pathway for effective disinfection and filling.
By the end of the shaping phase, the canals are cleaner, more accessible, and ready for thorough irrigation and disinfection.
Following irrigation, the shaping phase is complete. The canals are now sterilized and smoothly tapered, ensuring a successful obturation. Cleaning and shaping alone cannot completely eliminate infection from the root canal system. For this reason, thorough disinfection is a critical step in root canal treatment. Irrigating solutions are used to flush the canals and destroy bacteria that may remain after instrumentation. One of the most commonly used irrigants is sodium hypochlorite, which is highly effective at dissolving dead tissue and killing microorganisms. Vents. Modern techniques may also use ultrasonic activation to enhance the movement of irrigants, allowing them to reach tiny spots. As bacterial biofilms are disrupted and debris are removed, the canal system becomes progressively cleaner. Multiple cycles of irrigation help reduce the bacterial population to a level that the body can successfully manage. Once the canals are thoroughly disinfected and dried, the tooth is ready for the next stage of treatment. Once the root canals have been thoroughly cleaned, shaped, and disinfected, they must be sealed to prevent future bacterial contamination. This stage of treatment is known as obturation. With the canals fully prepared, we begin the obturation phase, carefully selecting the sterile gutta percha points for a three-dimensional seal. A biocompatible material called gutta percha is carefully fitted into each prepared canal. As the master cone is inserted, it must fit snugly against the prepared dentin, ensuring a perfect seal both at the apex and the coronal opening. An endodontic sealer is also applied to fill microscopic spaces and irregularities that may remain along the canal walls. The animation demonstrates the sealer flowing into the lateral canals. This is followed by the compaction of the master and
Together, the gutta percha and sealer create a three-dimensional seal throughout the root canal system.
After all canals have been completely filled, the dentist verifies the quality of the seal using a radiograph. As you can see, the obturation material extends precisely to the apex of each root, ensuring a complete seal with no voids. With the infection removed and the canal sealed, the tooth is now ready for its final restoration, which will restore strength. Here we see the completed root canal therapy on the lower first molar, with the 3 canals sealed with gutta percha. After root canal treatment is completed, the tooth must be restored to regain its strength and function.
Teeth that have undergone root canal therapy often have significant loss of tooth structure due to decay, previous restoration.
As a result, they may be more susceptible to fracture under normal chewing forces. To reinforce the tooth, a core buildup is often placed to replace missing internal structure.
In
many cases, especially for molars, a dental crown is recommended to provide long-term protection. The intraoral scanner captures thousands of data points, creating a precise digital impression of the prepared tooth. The crown covers the entire visible portion of the tooth, distributing chewing forces evenly and reducing the risk of fracture. The core buildup reconstructs the tooth structure, allowing the final crown to provide complete protection and a natural look. Once the crown is securely cemented into place, the treated tooth can function normally again. This final restoration plays a vital. We begin with a detailed view of the restored molar. The root canals are perfectly sealed with gutta percha. Although the root canal procedure itself may be completed in a single appointment or over several visits, healing continues long after treatment is finished. Once the infected tissue and bacteria have been removed and the canals have been sealed, the body can begin repairing the damage caused by the infection. Inflammation around the root tip gradually decreases, and the abscess begins to resolve. Specialized cells remove damaged tissue, while new healthy tissue develops in its place.
Under polarized light, the flawless integration of the restoration becomes clear. This is the definition of a healthy, protected smile.
We have followed the journey of a lower molar from the earliest stages of tooth decay to the development of a painful abscess. While modern dentistry can often save infected teeth, prevention remains the best approach.
Daily brushing, flossing, fluoride use.
And regular dental checkups can help stop cavities before they become serious infections. With proper oral hygiene and routine professional care, most dental infections can be prevented, helping patients maintain healthy smiles for a lifetime. Thank you for watching this educational presentation by Dr. Sila Biolabs.
Welcome to the lab. Today, we'll explore the root canal process using this advanced holographic visualization. Congratulations. You have now completed our journey through the science of root canal treatment and tooth abscesses. Today, we explored how a healthy lower molar can gradually become damaged by tooth decay. We also discovered how this infection can fit. Most importantly, we learned that root canal treatment is designed to save a natural tooth. By carefully removing infected tissue, disinfecting the root canal system, sealing the canals, and restoring the tooth appearance. A tooth abscess is not simply a toothache. It is a bacterial infection that requires professional diagnosis and treatment. We hope this video has helped you better understand the biology of tooth infection, the formation of abscesses. If you found this educational documentary helpful, please support our mission by liking this video, sharing it with others, and thank you for watching, and we look forward to seeing you in our next scientific journey. Stay curious, stay informed, and keep smiling. As you can see, the procedure successfully removes the infection, restoring the tooth to full health. Ever wondered why orange juice tastes terrible right after brushing your teeth? real reason. The real culprit is a common toothpaste ingredient called sodium lauryl sulfate, or SLS. SLS temporarily blocks your sweet taste receptors, so you can't fully taste sweetness anymore. SLS also removes protective compounds that normally reduce bitterness. That makes it seem much stronger than usual. No sweetness and extra bitterness make orange juice taste sour, metallic, and unpleasant. The solution is simple. Wait about 30 minutes after brushing before eating or drinking. Once your taste buds are fun fact, SLS helps toothpaste spread easily and creates the foamy feeling. This 3D animation showcases the dramatic transformation of correcting severely crowded and misaligned teeth using a combination of...
The story of the treatment unfolds in these distinct phases. The starting point. The video opens with a view of a patient's upper jaw, showing a narrow dental arch and intense crowding. Some teeth are completely blocked.
Expanding the palate. A rapid palatal expander device is fitted to the upper molars. Over time, the expander gently pushes outward, widening the upper jawbone to create much-needed physical space for the teeth to move.
Bringing hidden teeth forward. Once the jaw has widened, orthodontic brackets are glued onto the front surfaces of the teeth.
A flexible metal arch wire is threaded through them. The constant, light pressure pulls the severely misaligned teeth forward out of the roof of the mouth and brings them into alignment.
Perfect results. As the animation speeds through the shifting process, the teeth untwist and align beautifully. Resulting in a perfectly straight, wide, and healthy smile.
Everything is going to be fine, and we'll have you smiling confidently in no time.
I hope so, doctor. I'm just so nervous. All right, just slowly open for me.
Notice how the thermoplastic base flexes. It provides a level of comfort and fit that is unmatched by traditional rigid materials.
All right, let's try this. Just relax. It should fit perfectly.
I can't believe it. They look perfect.
Here's the function of taking a toll on this old porcelain bridge. Today, it will be replaced with a modern zirconia restoration. The existing bridge is carefully removed, exposing the supporting teeth underneath.
The canals are cleaned to create space for internal reinforcement.
A conditioning gel is applied to optimize bonding to the remaining tooth structure. The etching gel is rinsed away. A bonding agent is applied and cured with a specialized light to create a strong foundation. Custom fiber posts are inserted deep into the canals, reinforcing the weakened teeth from within. The core of each tooth is rebuilt using advanced composite materials. The rebuilt teeth are precisely shaped to support the future bridge.
An accurate impression is captured to fabricate a perfectly fitting zirconia bridge. The custom zirconia bridge is now ready for placement.
The new restoration is bonded securely into place and adjusted for a perfect fit. The result is a stronger, healthier, and more aesthetic from a failing porcelain bridge to a durable zirconia restoration. Strength, function, and beauty fully restored.
This clinical demonstration show a fiber post and core buildup procedure, which is performed on a badly broken or root canal tooth.
To structurally reinforce it before a protective dental crown can be placed. The medical procedure unfolds in these steps, preparing the canal.
Etching and priming. A blue dental etching gel is injected into the space to prepare the inner tooth walls.
It is thoroughly rinsed away and dried before a bonding primer is applied and hardened with a UV light.
6. Inserting the fiber post. A transparent, matrix-like crown mold is placed around the tooth stub. core. A tooth-colored composite resin is injected into the mold matrix, completely surrounding the fiber post to rebuild the physical
In the tooth. Once cured, the matrix mold is removed. The dentist uses fine shaping and polishing, turning it into a neat stub that is perfectly prepped and ready to receive a custom prosthetic dental crown.
Subscribe asking to return Powerpoint to Dr. Sila Biolabs.
Those bumps on your tongue aren't actually taste buds. They're called papillae, and they have 3 entirely different shapes and secrets. Filiform papillae form the Velcro-like texture of the tongue, but unlike other areas, they do not contain taste buds. First, the filiform papillae. They look like tiny hairs and cover most of your tongue. They have 0 taste buds. Their only job? Friction. They act like Velcro to grip food while you chew. 2. Fungiform, the taste caps. Second, look closer at the red, mushroom-shaped dots scattered around. These are fungiform papillae, packed with taste buds. These are the ones telling your brain exactly how sweet or salty that meal is. Finally, hidden way in the back, are the circumvallate papilla, arranged in a strict V shape. These massive, wall-like bumps act as the ultimate gatekeepers for bitter tastes before you swallow.
So, your tongue is basically
a monster with over 30,000 teeth in one lifetime. And humans? Only T2 for an entire life. One species replaces teeth forever.
The other pays thousands to fix them.
I'm Dr. Sila, and what you're about to see is unbelievable.
They don't floss, yet their teeth stay terrifyingly effective. That's because sharks grow teeth like a conveyor belt. New teeth are always waiting underneath. That's why dentists exist. Dr. Sila Biolabs presents a monster with over 30,000 teeth in one lifetime. And humans? Only 2 cents for an entire life. One species replaces teeth forever. The other pays thousands to fix them. So what secret are sharks hiding? And could humans unlock it someday?
I'm Dr. Sila, and what you're about to see is unbelievable. Because sharks don't brush, they don't floss. their teeth stay terrifyingly effective. That's because sharks grow teeth like a conveyor belt.
Dr. Sila Biolabs presents a monster with over 30,000 teeth in one lifetime. And humans? Only T20 sets for an entire life. One species replaces teeth forever. The other pays thousands to fix them. So what secret are sharks hiding?
I'm Dr. Sila, and what you're about to see is unbelievable. Because sharks don't brush. They don't floss.
Yet their teeth stay terrifyingly effective.
That's because sharks grow teeth like a conveyor belt. New teeth are always waiting underneath.
Human teeth are completely different. Dr. Sila Biolabs presents a monster with over 30,000 teeth in one lifetime. And humans? Only T2 sets for an entire life. One species replaces teeth forever. The other pays thousands to fix them. So what secret are sharks hiding?
I'm Dr. Sila, and what you're about to see is unbelievable. Because sharks don't brush. They don't floss.
Yet their teeth stay terrifyingly effective. Dr. Sila Biolabs presents a monster with 30,000 teeth in one lifetime. And humans?
That's why dentists exist. Imagine DHIS inside a mouth. I'm Dr. Sila, and what you're about to see is unbelievable.
Because sharks don't brush. They don't floss.
That's because sharks grow teeth like a conveyor belt.
New teeth are always waiting underneath.
Yours and microscopic. So how does this system actually work?
Dr. Sila Biolabs presents a monster with over 30,000 teeth in one lifetime. And humans? Only 2 sets for an entire life.
I'm Dr. Sila, and what you're about to see is unbelievable. Because sharks don't brush, they don't floss, yet their teeth stay terrifyingly effective.
Think of it like a biological conveyor belt. One tooth falls out, another instantly takes its place.
Your enamel is the hardest substance in your body, even harder than bone. But unlike sharks, once yours breaks badly, it's gone forever.
Shark teeth contain powerful fluoride-rich minerals, men. Nature built the protection in. Humans use toothpaste to imitate this. Scientists are studying shark genetics right now. Because one day humans may regrow teeth too. 2 species, 2 evolutionary masterpieces. Sharks mastered survival, we mastered everything else.
A monster with over 30,000 teeth.
species replaces teeth forever. The other pays thousands to fix them.
Think of it like a biological conveyor belt. New teeth are always growing underneath new cells. Built from stem cells, your enamel is the hardest substance in your body, even harder than bone. But once yours breaks badly, it's gone forever.
Megalodon, possibly 60 feet long, estimated bite force quirk up to pounds of pressure, enough to shatter bones instantly.
Shark teeth contain natural fluoride, built-in protection that humans try to copy with toothpaste. And if a shark tooth gets...
Scientists are studying shark genetics right now, because one day, humans may regrow teeth too. Both are masterpieces of evolution. Sharks mastered survival, humans mastered versatility. Now you've seen the visual side of this incredible story, but there's still so much more science behind it. I also created a full lecture version explaining everything in much deeper detail, with detailed biology, evolution, and real dental science. This video was designed mainly for cinematic visual learning, to help you SEE the science. But the lecture goes much deeper. Follow Dr. Sila Biolabs for more science documentaries, medical mysteries, evolution, and the hidden systems that keep life alive. Because biology is far stranger than science fiction.
Subscribe and join the Biolabs community. And tell me what topic you want next. And neither should curiosity. I'll see you in the next experiment. The next discovery may be more terrifying. Dr. Sila Biolabs. Explore the full lecture below.
Hello everyone, welcome to Dr. Sila Biolabs. Today what we will be discussing the 24-hour teeth melting crisis. Okay? What is the aim of making today's? It's not just to show you how your tooth is ring. It's to pull back the curtain on the hidden chemical war happening inside your mouth right now. Right now, what is happening in your mouth? We are going deep under the microscope to reveal exactly how everyday drinks launch an acid attack on your enamel, the outer portion of your tooth. The most hardest portion in our body, how the drinks launch an acid attack, and more importantly, how your body applies, how your body responds, an invisible defense force to stop it. Okay? The acid attack, the soda, the phosphoric acid, the orange juice, the drinks we use in the sports, that is called the energy drinks, the wine and coffee, all these, how these attack on our enamel, what does they do to our tooth? We will be discussing this in our video. The acid penetrates into the microscopic pores here, you can see. The minerals start dissolving away. The enamel, the outer portion of our tooth, it starts weakening. And how does our body respond? The defense system, the saliva that comes, and is acting 24/7. Saliva washes away the acids. Bicarbonates in the saliva, it neutralizes the acids. The calcium and phosphate rebuilds the enamel. And the natural cycle, it continues. The natural cycle protects, repair, and of course it repeats. But the main problem, what is it? The process of destruction and the process of construction. When the acid demineralizes, your tooth is destruction. Okay? And when the saliva remineralizes, your teeth are in a repair phase. But what happens when the demineralization structure of the enamel, that is our tooth. So we have to turn this battle in our favor. What we have to do? Use this to limit the contact with teeth. Rinse water. Okay, never ever brush immediately after drinking the soft drink. Because for 30 minutes your enamel is soft as the acid has already attacked. Okay? And give your mouth time to recover. Recovery is the real healing. Okay, every sip starts a battle. Every choice can change the outcome. So respect the balance, protect your smile for your life. We are not observing the signs. We are empowering you to take the control. I want you to take the control. Knowledge is power. Habits are your protection, and your smile is your worth defending. So we will be discussing all this in our today's video. So stay with me. You will love it. And of course, you will get a lot of knowledge. Okay, in our video, we will be witnessing the silent chemical war inside the beaker. We have placed the tooth in the beaker. And not only the silent war that is static, we will also be discussing the dynamic war that is happening in our mouth also. Okay? The goal of this experiment is not to tell you never to drink the soda again. As a dentist, my aim is to show you the exact molecular science, how teeth melts away, so you can understand the hidden biological countdown that triggers every time you take a sip. And how can you trick the system to protect your smile? Okay? I'm not asking you to leave the soda and everything. No. I'm just giving you the knowledge to trick the system, to help your body. Okay? When we drink the soda, the acid attack begins within 0 to 2 minutes. Drink with lower pH, cleanse your mouth. Acid penetrate enamel and start dissolving the minerals. Okay? The pH is low and the enamel starts dissolving. On 2 to 20 minutes, demineralization peaks minerals that the calcium and phosphate breaks away from the enamel. Look, you can see it's breaking away from the enamel. This is the way they are just causing destruction. Okay, the turning point. And after 20 to 40 minutes, the saliva comes. The saliva is in the mouth, but it takes over to neutralize the acid pH. Stopping further mineral loss and remineralization begins. After 40 minutes, remineralization saliva delivers minerals back to the enamel, repairing the early damage. And after 24 hours, full recovery with good habits, enamel becomes strong and the cycle is complete until the next sip. But if you take the sip again, the process starts again. This all demineralization process, again the minerals are going off the teeth and again all this happening. So the process of remineralization, this is construction, is getting at the lower level and the process of destruction, that is remineralization, is taking over. It's getting up, right? So when the demineralization is more, destruction is more, so there will be a cavity. Okay? So after drinking the soda, of course we all drink. So rinse with water. Give your mouth the time to recover. Try to take a straw while drinking. Eat smart foods, calcium rich, sugar free gum. The choice is yours. Understanding the science gives you the power to protect your smile without giving up the things you enjoy. Knowledge is protection. Habits are your shield and your smile. Of course, we worth it, you worth it. We have done a little experiment. We have left tooth in a beaker with cocoa Coca-Cola. So that we are not taking anyone's names. Okay, this is a human submerged tooth. Why exactly 24 hours? The answer is not just broad, it's just scientific crisis, okay? After 24 hours, what happened? You can see. Too much destruction in the enamel. The cavities are forming. The tooth enamel before was like this at the microscopic level, you can see. And after 24 hours, it's like this. So many pores because the calcium and phosphate, they are dropped off from the mouth, from your enamel. Demineralization in action step, okay? When we place the one tooth in static environment. Static environment, that is, it is continuous in the glass, okay? When we place it, immediately you can see the bubbles. They are attacking the enamel. It's just to witness the science you make. Your choice. We can only tell you, now it's your choice. You can witness it and then make your choice. It's not like for marketing, it's for real effects, not any excuses, real protection, real knowledge, okay? The silent chemical war that starts in our mouth. The acid attacks, acidic compounds, lowers the pH, and enamel starts dissolving away. Enamel starts dissolving away. Enamel erosion. Minerals are leached out. They are leaked out of the enamels, weakening our tooth structure, weakening our tooth defense, of course. Sugar feeds bacteria. Okay, sugar feed bacteria that can even produce more acid. So real knowledge, real protection. Okay? To the naked eye, the tooth looks normal. But when we see it through the microscope at 5,000 examination, magnification is 5,000. We see the 4 structural fissures appearing on the defense wall.
Do you see this hard yellow buildup on teeth? It's called dental calculus or tartar. Unlike soft plaque, calculus forms when dental plaque stays on teeth for too long. Minerals from saliva, mainly calcium and phosphate, harden the plaque into a stone-like deposit. Calculus creates the perfect hiding place for harmful bacteria. This can lead to bad breath, bleeding gums, gum disease, and even bone loss around the teeth. Dentists remove calculus through a procedure called scaling. Ultrasonic and hand instruments safely clean deposits above and below the gum line. Regular dental scaling helps prevent gum disease and keeps your smile healthy. Subscribe to Dr. Sila Biolabs. Every subscription supports dental education and awareness. Here is the step-by-step breakdown of exactly what is happening in that 16-second clip. 1. Preparing the surgical site.
Adjusting the implant fixtures. The dentist uses a dental drill and specialized hand instruments to clean, adjust, and prepare.
This ensures everything is perfectly aligned before the artificial teeth are attached.
3. Placing the temporary teeth. The dentist takes a custom-crafted set of temporary front teeth and slides it directly over the metal posts.
These temporary teeth are essential because they maintain the patient's smile, protect the healing surgical area, and help shape the gums. This locks the prosthetic securely into the implant post. 5. Final polish and suction. Once tightened, the dentist...
The patient now has a stable, immediate set of temporary front teeth to wear home on the exact same day as their surgery.
Hello everyone, welcome to Dr. Sila Biolabs. Today, we will be discussing the physiology of dental scaling and calculus formation. Yes, why do we need scaling and how the calculus is formed? You know the yellow substance formed on your teeth when you don't brush for some time? Now, understanding the science of oral health, from plaque to calculus formation. First, the thing is formed is called the pellicle. It's a soft layer. We will be discussing each and everything in detail. Then the plaque is formed, and then the calculus is formed, and then the mature calculus. Okay? This is how the calculus is formed. The pellicle is a salivary proteins coat the tooth surface within the minutes. That is the pellicle. And mature plaque. What is the plaque? Bacteria adheres to the pellicle. The bacteria in your mouth adheres to the pellicle, multiply and form a biofilm that is called plaque. Calculus. Minerals in the saliva or gingival pericular fluid precipitate into the plaque. That is the calculus formation. And then, how the mature calculus is formed. Calculus hardens, becomes porous, and promotes further plaque retention. That is how the mature calculus is formed. Today, we are diving deep into the topic that is critical to a tooth, both daily oral hygiene and clinical periodontology, the physiology of dental scaling and calculus formation. Whether you are a patient wondering why a hygienist scrapes off your teeth or a medical student looking to master the biochemistry of biomineralization and periodontal disease, this comprehensive lecture is designed just for you. Let's break down the science of a healthy smile. Understanding the why. Value the care. Keep smiling. Dr. Sila, Biolabs. This will be our lecture. And healthy gums doesn't just happen. They are engineered through science, care, and consistency. In today's lecture, mastering the physiology of dental scaling and periodontal diseases, diving deep into the biochemistry of biomineralization and calculus formation, and a comprehensive lecture designed for students and patients seeking the clear science. Here at Dr. Sila Biolabs, our mission is to empower medical education and simplify complex oral biology. In today's video, we are going to explore dental scaling, why it is necessary, how simply plaque transforms into calculus, the biochemical triggers of bad breath, what physiology happens during the healing phase after a deep clean. We will also address some common patient anxieties such as temporary sensitivity and why teeth can sometimes feel slightly lighter, looser right after scaling. So let's get started. So actually what dental scaling is. Scientifically, dental scaling is a non-surgical periodontal procedure. It involves meticulous mechanical removal of plaque, bacterial biofilm toxins, and hard calcified minerals deposited from both supragingival, which means above the gum line, and subgingival, below the gum line. Two surfaces, supragingival and subgingival, above the gum line and below the gum line. You can see supragingival above the gum line. The calculus is formed. Below gingival line, that is subgingival, below the gum line. Okay? Beneath the roots. Just below the gum line. Okay? Dental scaling is a precise non-surgical therapy that removes the plaque and calculus from above and below the gum line to restore the oral health and promotes the natural healing. Now, what is the clinical objective? The ultimate clinical objective here is to eliminate the local irritants, restoring a biologically clean, smooth root and enamel surface so that your gums can naturally reattach and heal. You can see before scaling, the gums swollen, the calculus is here, and after scaling, you can see clean tooth surface, healthy gums, reduced inflammation, support and reattachment of the gums. Before scaling, what it was? plaque, tartar, calculus, bacterial toxins, and inflamed gums. You can see. Okay? So scaling is just a non-surgical procedure, mechanical removing of the plaque, bacterial biofilm, and hard calcified mineral deposited supragingival and subgingival. Okay? Clinical objective was restoring a biological clean, smooth root and enamel surface, enabling the natural gum reattachment and healing. Now, why do we need scaling? Why do we need scaling? Home care has its limits. Toothbrush and floss are excellent at disrupting soft and uncalcified biofilm. Mineral fusion occurs. If plaque is left undisturbed, this plaque, if left undisturbed for some time or a short period, it begins to bind with calcium and phosphate minerals that present in your saliva. Bone defense is compromised. Once this chemical fusion occurs, the plaque hardens into the calculus. Brushing will no longer remove it. If left untreated, the calculus is physical shield for active bacteria, which secrete toxins that slowly destroy the surrounding periodontal ligament and alveolar bone. These toxins, what does they do? They secrete toxin. These bacteria secrete toxin, which slowly destroy the periodontal ligaments and alveolar bone. I will be showing you some differences between plaque vs calculus, the transitions of the plaque to calculus formation. Now plaque, you can see it's a soft, sticky and colorless, pale yellow, non-calcified, amorphous biofilm. This is the plaque. By the probe I will be showing you, this is the plaque. And calculus, it's hard, rock surface, yellow to brown calcified mineral deposits. Okay, this is calculus. Now composition. 80% of the, now we are discussing the discussion of plaque first, okay, composition of the plaque. 80% of the organic salivary glycoproteins, mucins and lipids, and 20% of inorganic contains living bacteria and byproducts, while the calculus is 80 to 90% of the calcium phosphate crystals, hydroxyapatite, octocalcium phosphate, and 10 to 20% of minimal or no living bacteria. Plaque, yeah, it can be easily removed at home from toothbrushes and dental flosses. But calculus, it cannot be removed at home, requires professional. Removing uses ultrasonic scalers or hand curates. Health threat, plaque, it can lead to gingivitis, cause mild reversible inflammation, redness, swelling, and bleeding. Okay? It will trigger gingivitis, reversible inflammation, redness, swelling, and bleeding. But calculus, it causes periodontitis, leads to chronic inflammation, and pocket formation and permanent bone loss. You can see what calculus is doing. What calculus is doing? Chronic inflammation. Chronic inflammation. Periodontal pockets and destruction of the bone. That's what calculus is doing. So plaque is the cause, calculus is the consequence. Remove the cause early to prevent the irreversible damage. Plaque, gingivitis, calculus, and then periodontitis. That is irreversible. So professional care makes the difference. Okay, so what plaque to calculus? As we discussed, plaque, soft, sticky. Calculus, rocky hard. Plaque has salivary proteins and living bacteria. while the calculus, calcium phosphate crystals. Okay, plaque can be removed by brushing and flossing, and calculus, it can be removed by scalers and curates. Plaque, mild reversible inflammation, and calculus, permanent irreversible bone loss, periodontitis. Now let me describe the main culprit dental calculus in detail. Think of a calculus as a fossilized plaque. When a soft biofilm is left undisturbed along the gum line, it acts as a scaffolding matrix. Over time, minerals, salt precipitate into this matrix. Although the calcified core of the calculus consists of largely dense fossilized bacterial cells, its outer is extremely rough and porous. Calculus is bacterial reservoir. This is rough porous that makes calculus the perfect harbor of a new life. Multiply and constantly secrete destructive toxin directly into the gum tissues. Bacteria attach to the rough surface. Bacteria multiply and form colonies. Bacteria release toxins. Now, toxins penetrates gum tissues and causes destruction. See the pathogenic reservoir, dental calculus. Now, fossilized biofilm, calcified forming a dense matrix, rough porous surface, you can see, not solid, extremely irregular topography. Bacteria harbor the perfect safe house for pathogenic colonies to attach and multiply. Bacteria constantly secrete toxins into the gum tissue. Outer porous matrix, you can see. These are the bacteria secreting continuous toxins to your gum tissues. Pathogenesis step by step. First, the pellicle is formed within minutes of brushing. An acellular protective film of salivary glycoproteins. The acquired pellicle coats the enamel within minutes. Then, biofilm, that is plaque. Bacterial colonization within 24 hours. Primary bacterial colonizes adheres to the pellicle and multiply to create a dense biofilm. Then mineralization of the calcium phosphate begins. Calcium and phosphate ions from the saliva start to precipitate into the matrix. Then fossilization of the plaque, maturation of the calculus by the day 12. Fossilization, maturation of the calculus by the day 12. The deposit matures into the fossilized, rock-hard crystalline structure that is